by Dr. Michael Morley and Dr. Katharine Morley. Dr. Michael Morley is an assistant clinical professor at Harvard Medical School and at Massachusetts Eye and Ear Infirmary in Boston. He graduated from Boston University School of Medicine and obtained a Master's of Healthcare Management from the Harvard School of Public Health. He also has an interest in teaching residents, fellows, and medical students from Harvard and Khon Kaen University. Khon Kaen University, working together as a team, Dr. Katharine and Dr. Michael have worked on global health projects for many years in many countries, including nearly 15 years in Thailand. They worked together on a Fulbright Specialist Grant in 2015 in Khon Kaen concerning patient safety with Dr. Chat and Dr. Apichat. Their global health interests include M-Health, capacity building, patient safety, and clinical quality improvement. They were members of one of the winning teams of the 2016 MIT Hacking Medicine Hackathon. And Dr. Katharine, also a clinical instructor in medicine at Harvard. She practices in the Department of Internal Medicine at Massachusetts General Hospital in Boston. She graduated from Boston University School of Medicine. She received an MPH at the Harvard School of Public Health with a concentration in global health. She has written approximately a dozen successfully funded grants in global health. She mentors medical and public health students from Harvard on global health projects. So please welcome Dr. Michael and Katharine Morley.
So good morning, Khon Kaen. It is very nice to be here. We are really excited to be here today. Okay, thank you. So we are very excited to be here today. It was a little over a year ago that we started to work on developing the idea of having a hackathon here at Khon Kaen, and to see that it's finally coming to fruition, and to see all these young, excited, enthusiastic people in the room is it's wonderful. It's very nice. So, so like many of you, I think a lot of the reason that many of you are here today is because you have an interest in innovation. We have a lot in common. So we have a lot of things that we'd like to share with you, and that we hope that you will share back with us. So for those of you that really want to cut to the chase and know what are we going to talk about here today, here's a summary of my lecture. So if you want to listen to the whole thing, you can just get it in one slide here, basically. The first comment is that all four speakers yesterday mentioned that healthcare is a very complex thing. It's not simple. And because of that complexity, we have a lot of problems, but we also have a lot of opportunity. And that's why I think we're here today, is to try to make opportunity come from some of the complexity that is present in healthcare. So there are many opportunities that we have to improve healthcare, and we're going to try to find some of them today. A second and very important point, again, this was touched upon by all three people yesterday, all four speakers yesterday, is that patient safety is really important, and preventing errors, it's just as valuable as making a new medication or inventing a new device. And the third point that I want to bring up is that we'd like you to think creatively. Don't be afraid. Try to think about new ways of doing things. So for those of you that are engineers and don't work in the field of health, if you watch TV or a movie, healthcare seems fairly simple for the most part. It's often depicted as a doctor and a patient. They come together, a treatment is prescribed, the patient is cured, everybody's happy. And it's very easy It's no problem. So for those of you that are engineers in the room, you might write a formula for health, something like this. So healthcare would be the doctor and the patient get together, a treatment is performed, and healthcare is the outcome. That's the output. So it's pretty easy, right? We all get that. The problem is healthcare is not that easy. It's much more complicated. There's many people that are involved. So there's a lot of people. There's doctors, there's nurses, there's therapists, there's laboratory people, there's computer people, engineers, support people. All of these people are necessary for the delivery of good healthcare. If you take any of them away, the whole system falls apart. So there's a lot of people that are in the loop here. And then there's a lot of locations. You don't go to just one place to get healthcare. There are many locations. There's a hospital room, there's an operating room, there's an emergency room, there's an intensive care unit, there's clinics and offices, pharmacies, even in the home. So there's a lot of locations that we have to consider. And in each of those locations, there's a lot of processes that happen, right? So a process like admitting to the hospital, you have to be discharged from the hospital, transporting patients, drawing blood, getting the medical records. Again, a lot of steps that need to take place for healthcare to be successfully administered. And then the age-old problem of communication. In healthcare, there's a lot of communication loops. There's certainly the doctor and the patient, but we also have to think about the nurse and the patient, the family and the doctor, radiology, blood test results. All these are communication elements that need to take place. So healthcare is very complicated. So we started to think about, well, what would an equation look like for healthcare if we started to incorporate some of that complexity? Does that look complicated or what? So I purposely tried to make this kind of scary looking. And for those of you that are the design people in the room, or those that are in the humanities and this, and the engineers, I hope will have a fairly easy time kind of come to grips with this. But basically, if you're not an engineer, this is just a long list of things that we might want to think about as we go into the hackathon, about ways that you might want to have an intervention. Or it's a way that places where you might be able to do something. So each of these letters, doctor and patient, this used to be treatment. Now that we've had treatment broken down into medicine, surgery, devices, and hospital, location basically. Then we have some special exponents here, access, quality, and cost. And then we've got some new parts of the equation here that we didn't have on our simple equation. There's a whole section here on errors, patient safety, and we have a section here on patient behavior and their knowledge, patient's knowledge about healthcare. So the formula doesn't matter. It's just a device to let you start to think about the many different variables that are involved in healthcare that you might be able to intervene as you go into the hackathon. So let's look at some of these variables. So we're going to start with the doctor. I know in my field, and I think it's true in all the fields, medical knowledge is what the doctor uses. That's their tool. But knowledge is growing so fast that no one person can keep up with it. Leo was telling me yesterday from his MIMIC database, they're getting one paper a month out of their MIMIC database. That's from one team. Across the whole world, the volume of information that's coming down the pipeline is way bigger than anybody can manage. So there's a huge need to make knowledge accessible and simple and fast for physicians. Many engineers will say, well, the doctor has to have a lot of skill. If you have to be a surgeon, you have to make do a good case, you need a high level of skill. So developing new ways to practice and develop your skills, particularly in emergency situations, such surgical simulation can be an interesting thing to think about in terms of apps for improving physicians' ability to perform at a high level. And KKU actually has a very excellent simulation center, which is a resource that can be used. And then the doctor has not enough time. That's another problem area where technology might be useful. So using technology to explain information to patients, for example, can save a lot of time for doctors, nurses, and patients. In the Department of Ophthalmology at Khon Kaen, Dr. Tuss, one of our partners, Kathy and myself, are developing a line messaging system for patients undergoing cataract surgery. These patients get a series of planned messages and videos about cataract surgery post-op care that give patients information when they want it in the format that they are comfortable with. So how about patients? So the patient needs knowledge about their problem and their treatment and their disease. And some patients want to know a lot. Some patients only want to just know a little. They don't want to know very much. And giving patients the information that they need when they want it, in the format that they are used to engaging with, for example, video or text messages or line messages or Facebook, and at a level that's easy to understand, is a really important aspect of healthcare for patients. An example of that would be patients' compliance or adherence to their medications and to their office visits can be improved with apps. It's really very well demonstrated that both medication compliance and post-op visit compliance is improved when patients are reminded through smartphones. So I'm just going to very briefly touch on this because I think a lot of people in the room, that was their idea what the hackathon's all about. They wanted to come and develop a new medication, a new device, a new procedure. And so the treatment's an obvious place for new technology because patients and the doctors want new and better treatments. And it's also, frankly, it's an area where there's a lot of money to be made. If you can get a new treatment going, you're going to make a lot of money. So in my field as an ophthalmologist, we use drugs that are made by very high-tech bioengineering procedures which have really dramatically lowered the rates of blindness in my field. Also, we use new imaging machines. We can look at the retina now with micron level accuracy, all due to high tech, all due to technology. Even contact lenses. In contact, most people think, oh, I'll put in my contact lens so I can see far away. Nowadays, contact lenses are being used to deliver medications to the eye. They're used to measure the pressure in the eye. And they're using actually contact lenses to monitor blood glucose levels. So there's tremendous opportunity in this area for the technology to make a big difference in healthcare. Okay, so we're going to talk next about these three elements here. So access, quality, and cost. So for those of you that are engineers, you probably won't have any problem understanding that these are called exponents. And exponents are special when you use them in an equation like this, because the exponent, an exponent is, signifies the number of times that you would multiply a number by itself. So these have a very powerful impact on what happens in here. So if access and quality are high, it really enhances what's happening in here. If access and quality are low, you're going to have a low output from healthcare. So those are important. You have to understand these are really powerful parts of the equation here. So let's first talk about access. So the first principle is that if you don't have access, you really don't have any care, right? So this is a picture of a house that we saw doing a rural cataract screening, very far away from healthcare. It's very far. It's a long, long, long way. You don't see any motorbikes in here. These people can't jump on their motorbike and go off to the doctor. They really don't have much healthcare at all. And these people have worse health problems because of it. They don't have access to care. This family would benefit from technology to remotely access healthcare, and that would be something that you guys might be able to help with. It may not be as good as having Sirikunakorn and Khon Kaen hospitals right nearby, but being able to visit a doctor or a nurse by line video call, or to send a smartphone picture of a laceration to get advice is much better than no care at all. Another example of how technology can improve access to care, one of our dear friends and colleagues, Dr. Aim Warachaya in the Department of Ophthalmology, has been developing a telemedicine project with her colleagues at Harvard to improve access to health care for premature babies by using imaging technology for the retina to detect retinopathy of prematurity, which is a very severe and blinding disease for young premature babies. And so Dr. Aim is actually using technology to improve access to health care to rural people. It's nice. So quality. Quality, we heard about this 4 times yesterday, 4 times, that quality matters, and it does matter. How many of us would be okay if our parents went to the hospital and they came home with a severe infection that they didn't have when they went to the hospital? They got it from being in the hospital. That's not good care. It's not high quality. So Khon Kaen actually has world-class medical care. We know, we've worked around the world and seen the very best of the best, and Khon Kaen is at that level. But all health systems can be improved, and Khon Kaen and Harvard are no exceptions. Good quality is, one way to think about quality is to make the right diagnosis and give the right treatment at the right time. So that's effective care. That's what we're after. That's good quality care. Good quality care also is efficient. You don't waste time, you don't waste money. Dr. Sally yesterday showed us a slide that said 30 cents out of every dollar is wasted. Wasted. 30 cents out of every dollar is wasted. We can't afford that anymore. We have to eliminate that waste and improve the quality of our care. And technology can help us do that. Now cost is a denominator here. So if cost goes up, our access is going to go down, right? This exponent's going to get smaller. So this whole region in here is going to be suppressed if we have high costs, because people won't do it. In my office, if I prescribe a glaucoma medication that's $100 a month for the patient, they either won't buy it, or instead of using it twice a day, they'll say, well, I can only really afford once a day, so I'm just going to use half as much as I'm supposed to. So that doesn't work. We need them to use their medications as prescribed, and if they're too expensive, they're not going to take it. Cost can also affect whether a patient will come back to a clinic regularly or not. If you have to come back all the time for an eye visit to check the pressure or to check your blood pressure, and it costs even 30 baht, for some people I think coming back 30 baht once a month is not insignificant. So costs can definitely affect healthcare outcomes. Okay, medical errors. It's a painful topic, right? Who wants to think about, we go to work every day trying to make the world a better place. I look out and I see young people that are trying to rise and be helpful to people. We don't want to think about hurting anybody, but we have to talk about it because occasionally we do hurt people. You heard yesterday that the Institute of Medicine estimated that in the United States, at least, there's about 90 or 100,000 people a year that are killed by healthcare. Can you imagine that? And in Thailand, it's probably no different, or proportional. So we want to work on reducing that number. One thing for the engineers that are in the room, this is something I'm particularly fond of, is something that's called a forcing function. So forcing function, so you all have a microwave oven, you know how to use it. You put your food in, you close the door, and you hit the button to turn it on. So if you've ever tried to turn on the microwave oven without the door closed, it doesn't work. You're forced to close the door. It's good. That way you're not going to put microwaves all over the kitchen, no one's going to be injured. So that's called a forcing function. in medicine, forcing functions are really valuable because we can force we can remove errors by using forcing functions. For example, Dr. Tao, who's going to be helping us later in the week on our research project about the hackathon, is an anesthesiologist, and he knows that they have different connectors for the oxygen and anesthetic gas. It forces you to use only the right connection for the oxygen and only the right connection for the anesthetic gas. You can't mix it up anymore. Whereas in the olden days, occasionally if you weren't paying attention, you'd mix them up and the patient would die because they didn't get enough oxygen. So forcing functions, if you're an engineer, if you can find a place to use them, are very valuable. So to show you again how much I care about reducing errors, this is the only variable here that we're talking about errors with 2 slides. And I squared this one. This is another exponent where I gave it double the value of all the other ones. And the reason for that is because errors have a huge negative effect when they happen. Just even personally, they can have a negative effect if they were to happen to somebody in my own family. But even to the whole Khon Kaen medical system, you have really mad patients. If you've injured them, they're not happy at all. They're angry. Their families are irate. They're really mad. The doctor feels terrible. They're ashamed. It's terrible. You read newspapers. It's in the TV news. It's a really bad situation. So errors are very bad, and also errors have a negative sign right here. So for the engineers, you guys know we're going to subtract all of those errors. The sum of all these errors are going to lower the outcome here. And the one thing that's worth noticing here is that if you lower errors, it's just as good as a new drug, right? You're going to get a better outcome down here in health if you lower errors. It's good. So pay attention to that. If you can find a way to make care safer, it's better. Okay, patient behavior knowledge. So you can say, well, you already talked about the patient over here. Well, how come you're bringing it up again? The reason when we talked about the patient here, this was when they were acutely sick. They have a broken leg, they have a laceration on their head, they're acutely sick. What we're talking about here is patients' behavior that they acquired over a lifetime. If they're a heavy smoker, if they drink too much, if they have a lot of bad behaviors, you're going to have to subtract that out if those are negatives. But on the other hand, if they have good behaviors, if they do exercising, they eat well, they get good sleep, those are positive behaviors. And the more knowledge a patient has about these things, the better patient behavior is. Okay, so to wrap up my part here, I'm going to tell you again what I think are the important points. One is that this is a really long equation, but it means there's many opportunities to improve healthcare. So if you're not an engineer and you don't care about all these things, there's a lot of opportunity. The second point I want to emphasize again is that reducing the bad things, the problems, medical errors, patient unhealthy behaviors, is just as valuable as making a new treatment. And the third thing that you should know is that the hackathon is a great opportunity to be creative. Don't be afraid to try ideas that might improve this. So my last slide. Let's say you go into the hackathon and you come up with a great idea. It's really smart. You're really clever. You came up with a really cool idea. If it only stays an idea in people's heads, you've done nothing. You haven't changed anything. You've got to implement your idea. And you say, well, that sounds like, I don't want to pay attention to that now. I just want to come up with a good idea. But you should be thinking about this right from the start. The great businesses of the world, the Googles, the Microsoft, Apple, DTAC, True, Singha, those are companies that were able to implement successfully. And you're going to hear more about that right now. I'm going to introduce my wife, Katharine, who's going to speak about implementation.
Okay, So we have the formula for good health. We know what we need to do. Now we need to put it into action. And I'm a physician, I'm a practicing clinician, but much of my career has also been spent in healthcare management and administration. So I actually have a lot of experience trying to implement things. And that means I've had a lot of failures, but hopefully I've had some successes too. And what I want to do is share a little bit of my experience and try to convince you that this is an important part of the hackathon. And it's often said that implementing is actually the hardest step of anything, and I actually believe that's true. Let's see, let's go. So my two goals for this lecture are, first of all, to convince you that including an implementation plan is critical for the success of your hackathon project. So you're probably thinking, wow, I don't even have an idea yet. How am I going to, I shouldn't even have to think about implementing it. But I'm going to try to show that that's to get you to think otherwise. And secondly, to try to show you a simple, practical approach to incorporating implementation that's based on quality improvement science. So I'm going to use a lot of I words, and I thought it might be helpful just to run through them briefly so we all have the same meaning. And so one of them is innovation. And innovation is the word that I'm going to use to describe the idea or the concept. It's basically what you're going to make in the hackathon. It's what you're going to create. So I'm going to call it your innovation. The next word is intervention, and that means doing something. It means, in this case, I'm going to be using it with regard to your innovation. You're going to make a change or a modification to your innovation, and that's an intervention. And finally, implementation. I just thought it would be helpful to look at some other words to see some of the other definitions of it. First of all, put it into practice, enact, operationalize, perform, and make it happen. So you see that they're all action words. It means doing something. And why do I think it's so important? This sums up my #1 goal of the talk, is that you can have the best innovation or idea, but you're not going to improve anyone's health unless you get people to use it. And that's what implementation is. It's all about getting people to do something. So it's about motivating people to adopt something, to make a change in their behavior. And that's not always easy. And that's why implementation is such a challenge. But fortunately, there are a few strategies that we can even start to think about here in the hackathon. And there's actually a whole body of science behind this, and it could be a whole week's conference on strategies on this. But I'm just going to touch on a couple of topics. So I have 3 things that I think you could think about to maximize the chance of successful implementation of your hackathon innovation. The first one is to use a SMART statement to focus your innovation, and I'll talk about each one separately. The second one is to make sure your resources match what you want to do, or what I call your aim. And the third one is to do a pilot with PDSA cycles, which I will talk about. So first, we have the SMART statement. And SMART is an acronym for specific, measurable, attainable, relevant, and time-bound. But the core message here is to really try to define what you want to do. And this is where, in the hackathon process, you're meeting with clinicians, that you get together and you learn about the problem, the situation in which you want your innovation to work. And you need a lot of knowledge in order to specifically focus your innovation. And sometimes it's talking to people, it's using the resources in the community, it's doing internet searches, it's going out and doing, asking questions to your mentors. So really try to think about what is it exactly you want to do. Because if you have a clear and specific aim, it's much easier to implement. Measurable is included here because it's always nice to have something that we can follow, that we can monitor, and you'll see more about that later. Attainable, meaning that you can actually do it. So if you try to do something that is really too big that you don't have the resources to do, the knowledge, you're never going to be able to implement it. And this is where being specific and focusing on your innovation early on when you're developing it is that you're much more apt to have something that you can actually do if you have it focused and narrow and attainable. It also has to be relevant. People have to want it. Remember, implementation is all about changing people's behavior. If it's not something they're interested in doing, they're not going to use it. So you have to, this is where your background research comes in, is really knowing, is there a need for this? Has somebody done it before? Does it already exist? Am I going to create some new problem by putting this in there? So you really need to ask yourself this series of questions to see if it fits the need. And time, you know what, it's good to be on schedule. We need to be organized. It keeps us focused, and it's much easier if you've set that out from the beginning. So number 2, do your resources equal your aim? And this is important because it makes you plan, right? You can't answer this question unless you know what you're going to do. And so you need to plan. You need to know, who do I need on my team? What kind of people need to be involved to get this done? What kind of training they may need, right? We're going to have somebody do something new, they probably need some training, right? Do we need to have meetings? Do we need to do it on the internet? Can we use social media? These different methodologies require different amounts of resources. So if you think about all that ahead of time, you're in a much better position when you actually try to go live or put your intervention or your innovation into action. Communication, it's all about getting people to do something. You've got to be able to communicate with them. So you've got to have a good system and a plan and a clear message. Funding, it always comes up. You've got to be able to get some money somewhere to do what you want to do. And so you know, if you have a good focused project, you'll know how much money you need, and then it's much more attainable, and how much time it's going to take. Everybody's busy, right? You can't take on something that you don't have the time to do. And if you go through this process early, while you're developing your innovation, you'll realize, wow, there's a mismatch. There's nothing, my dreams were too big. I need to scale them back. And so if you realize this early, that's good. You can make a change. You change the scope of your project, you narrow your focus. Number 3, do a pilot with PDSA. We heard about pilots yesterday, and pilots are great. You know, you can get a lot of information by trying it and seeing if it works. And I think that's really important. You identify problems early. But I'm going to make a case for trying to do a different kind of pilot that at least uses this tool from quality improvement called PDSA. It's called Plan, Do, Study, Act. And what these is a way to get a little bit of data, a little bit of quantitative information about your intervention, meaning if you make a change to your innovation, what is the result from that? And if you have a little bit of concrete information, quantitative information, you can then use that to start making improvements. And if you can do some of this before you go live, it's a lot better when you try to implement it. So here's just a little bit more on the PDSA cycle. It actually has its roots in engineering, so I'm sure a number of these people in the audience have heard about this. But the idea is that you take your innovation, you say, okay, let's try something. You get a little data back. You find something that's easy to measure, that's sort of built into the process, so it doesn't take a lot of work. It doesn't have to be a statistically significant sample. It's just enough to get the information you need. You get that information, you analyze it and say, oh, let's try and do something different and make it better, and you do it again and again. So let's look at an example where we can see what it's like to use a SMART statement and a PDSA cycle to develop an mHealth innovation. And so here's my problem. Problem is that pregnant women in Northeast Thailand don't always complete prenatal care. Now we know this is important because prenatal care has really been shown to have healthy babies, healthy moms. You know, it's really an important and vital part of good health. But that's a really big problem, right? You know, we're talking about all of Northeast Thailand. Prenatal care is a lot of different stuff. And so this is where you get together with your team and your clinicians and you think, gosh, let's try and understand the problem a little bit and figure out what out of this is attainable, relevant, and very specific that we can develop an innovation for. Because when you do a hackathon, you start with the problem and then you develop the innovation, not vice versa. So we go through this process. We talk with our team who knows a lot about the prenatal care in the area, and we come up with a different way of putting our problem out there, and that's to decrease the percent of pregnant women who do not attend prenatal visits at Sirikunakorn Hospital by 10% by June 1st of 2017. Attainable, don't you? We also have something that's measurable. We're going to have a decrease in the percent of the people who don't keep their visits. So you do some background research, you know that, there's probably about 30% of the women that don't keep their appointments, and we think maybe we can improve that by just 10%. That would be a big help, right? So we don't have to go for the whole thing at once. We just want to make a little bit of an improvement, and we've given ourselves a timeline. We have 6 months to do this. So you can see how the SMART statement takes this broad concept and lets you focus into something that seems like, wow, I could actually really do that. It's a lot easier to implement this one. This seems like a lot easier to implement than this, right? So now let's try it with our pilot with PDSA cycles. And so you've been in your team, you come up with an innovation, and just for sake of discussion, we're going to use a messaging app, all right? And we're going to see if we can improve compliance with the prenatal visit. And so we have our intervention here, a change to our innovation, and we're going to send them a message that says, remember to come to the prenatal clinic on a specific day. We'll just say February 1st. So you send them that message, and then here, you have something to measure. If you're using line, you can tell when the patient's read the message, right? So here we have our measurable component. We can see the number of messages that actually got opened. If nobody opens the messages, we know that our innovation is going to fail. We're never going to implement it. It doesn't work. So we know immediately, before we even tried, that we would have a problem. But we're lucky. We see everybody likes line. They're opening their messages. 90% of our messages are opened. That's great. That means we can actually go forward with our innovation. So now we send them a message. We're asking the patient, will you come to the prenatal clinic on February 1st, or a specific day? If not, why? So now we're trying two-way communication. We'll see if we get any information back. We're going to get information about, does two-way communication work? And we're also going to get information from our patients about why they don't keep their appointments, which ultimately is what we need to know to solve this problem. So we do this maybe for a few days. You don't have to do it a lot, just enough to get enough information. And we see that, well, we're getting a lot of messages back. And we often see that they say, it takes too long. I have to wait there all day. So we feel, oh, it's wait times. It's the time that it takes. So then we think, how can we improve our innovation to address this problem? We haven't even tried to implement it yet. We're still developing it. You send a message with a time slot that says, come at 1 o'clock, come at 2 o'clock, come at 3 o'clock. And we see, do people sign up for this? All right? So another measurable thing will be the number of people who sign up. And then but we're worried, are we creating a problem in the clinic? Is this tough for our staff? Is it making the problem worse? Because you want to make your change an improvement, right? So we survey our staff, and we get a little more information back about what they think about it. So this is the process that you can go through, even in the development phase, before you go live with your innovation. And you've already learned a lot, and you've made it better. So these things, the better it is, the easier it is to actually implement it. I just want to make a couple other points about the benefits of using this methodology. Is that it can take a long time to get your final results, depending on what your final outcome measure is. For example, do we want to make sure all the women get complete prenatal care or keep all the appointments? It may take us a long time to collect that information. If we use these PDSA cycles, we collected a lot of information in just a week or two. So it's fast, it's built into our system. And this, this early quantitative information can help you engage stakeholders and supporters. So early on, you have to convince people to make a change. That's what implementation is, right? We have to convince the people in the clinic that this is a good system. So if we show them the information, that how it's improving the flow through the clinic, the patients like it, we're doing a better job of getting them into prenatal care, it's easier for everybody to go along with this change. They'll be adopting it more readily. And also, we can show that to the hospital administration. It's like, oh, wow, these people know what they're doing. This is a good idea. They're making change. They're making something happen. And if we need to get money, then we can show it to our funders. We already have some data that shows we have a good idea that has potential to work. And probably the most important reason is this one, is that you can continue the same methodology after you actually implement your project and go live with it. And that's really important because that's when projects fail, is when you try to make them go live, unless you have something in the process to keep working on them and improving them and continuing to what they call hardwire it into the system and make it sustainable. So in sum, these are the important things to remember, is that plan from implementation from the start. Even as you're just developing your idea, there are a lot of very, very good opportunities to think about, can I really make this happen? And then you should be asking yourself that starting tomorrow. And if you can't, there's a lot of opportunity to change, to make adjustments, to focus it down, use the SMART statement to really try and be specific and make something that's attainable and relevant. Communicate and collaborate. This making change and implementing something takes a lot of teamwork, as a hackathon does. And you need to communicate, listen to each other, and it's a fundamental part of the whole process. Also, implementation is not linear. You have to be able to go back, make changes, make adjustments. And if you're not doing that, you're probably doing something wrong unless you were incredibly lucky. But almost nobody gets it right the first time. And you shouldn't be discouraged about that, because that's your opportunity for improvement. That teaches you ways to improve your innovation so that when you go forward, it will be more successful. And then finally, and it's been my experience every time, that the biggest work starts when you go live. So a lot of people, when they're developing ideas, they think they've been thinking, they've planned everything out, now we're going to start it. I'm done. I don't have to do anything else. That's the day you really start doing your work, because you have to change people. You have to get them to do this. And you have to be there, you have to pay attention, you have to communicate, you have to look for the problems, you have to monitor your process. And that's what will separate the successful from the unsuccessful projects.
Yes.
Thank you, Michael and Katharine. I really appreciate your presentation, and I think the way that Professor Michael represents the complexity of healthcare is very smart. But my question is that how we know that information for the decision making at the point of service is very important. How we gonna put the information into this kind of the equation? Information always behind the scene. If you cannot put this in this kind of the equation, then you cannot make case to the people. The equation is very amazing. I really like that equation, and I would like to use it as to explain the complexity. Combine your equation with the slide Dr. Ken showed us yesterday. It really convey the message to the people, like the IT people or the administrator. So just a question that how we gonna put information into that kind of the equations.
I think it's a very difficult question to answer easily. I think that engaging people, I think this cross-silo collaboration that we're doing here today is an example of something I think that would facilitate that a little bit. Bringing together IT and clinicians, I think is a very good start. I think doing it at your level, which is that bird's eye view level, building it in, the communication capacity right from the start early on, I think is important. It's a fundamental challenge that we face. What do you think?
Any more questions?
Thank you.
Yes.
Good morning again. I'm from Chiang Mai University, so it's far away from here, and the airplane ticket is expensive, so I want to use my time to attend the session as much as possible. My question is, you talk a lot about the incentive idea, how to get people to involve to the application that we developed. Do you have any example of those incentive idea that can attract those people to use the application that might be helpful for the student who are attending hackathon tomorrow? Thank you.
Well, I think that's a good thought, because you have to think about, does anybody want to use this, right? And so the question you should be asking is, at the time you're developing it, does anybody want this? Why would they use it? And who would use it? And if you can't get any answer to that, then, it takes research actually to figure that out. You need to go out and talk to the people, or do, for example, if you wanted to see whether they would like to use the messaging app, you could go out and do a survey in the community. Or I actually just sort of built it into the process of developing it. We were getting feedback from the patients to see would they use it or not, or feedback from the staff, does that cause a problem? But you can also look at the literature. A lot of these things have been tried before, and you could see that it didn't work. And if you get someone who publishes why it didn't work, that's good information. And you could also look and see what would incentivize somebody to use it. I mean, there's all the carrot and stick philosophy. There's a reward or a punishment. So thinking about, for example, the prenatal clinic, maybe there's something that if you get to all your appointments and answer these, then you get, I don't know, a little prize at the end. So you can motivate people through positive incentives. I think they're better than negative ones. Negative is kind of punitive, especially when there are a lot of factors that would impact somebody's ability to do that. I mean, sometimes you can offer free transportation if access is an issue. But I think the fundamental question is, say, does anybody want to use this, and what would prevent them from using it, and how can I make them want to use it? And it's understanding your audience, the market you're trying to sell it to.
Yes. Last question.
I think this is not the question, is to complement yours. Actually, there is a literature in the adopting of the IT, a lot of literatures. I think some of you may familiar with the TAM model. To answer, is it easy to use? Is it usefulness? Is it have the support from the other, how the social? This is the 20 years model. And you can look at the literature under the TAMs, TAM, T-A-M, technology adopting model. Or the new one is the UTAUT model, UTAUT model. And this will answer your question that how we gonna use our go about people adopting the technology. It's a lot of literature working on this. Just Google it.
We've been impressed to see how much people like stickers on the line messaging service. A little thank you or have a good day, whatever. I mean, it really engages people with surprisingly little effort. So just one small item.
It has to be a quick question. We have just run out of time.
This is not actually a question, it's just the idea to share. As I developed the mHealth application to collect the determinant of health data in the community, as I mentioned before yesterday, one incentive idea that help people trying to input more information on the apps is to create the local competitions. Yeah, like from this health station or this district, I create a visualization graph, bar graph, to compare each district. Like if today, this district, they get 100 households, and this district only 20. And then the next day, another district with the small numbers of households, they will like come up with some strategy to beat another district, something like that, which is really fun, and it's like a competitive between healthcare professionals in the community and make them fun, and it's not boring. Thank you.
That's an example of showing the value of having something that's measurable or data. When you're trying to implement something, people are motivated by that, and you can use it to engage your audience or your stakeholders. So it's a great example. Thank you.
We have like half an hour break, and you can ask the question in those time. Thank you very much. The next talk will be by Mr. Collin Fair on bringing e-health solutions to market. Mr. Collin Fair is a senior software engineer student at the University of Waterloo in Canada, with industry experience ranging from highly scalable cloud infrastructure to low-power wearable devices. His interests lied in developing practical solutions that integrate hardware, software, and existing resources to address concrete challenges across disciplines. Previously, he has worked with Sana to create a patient-centered mobile health record solution to address the unique problem of long-term healthcare in transient refugee populations. He was also a member of the winning team at the 2015 United Nations Population Fund Hack for Youth Hackathon in the Ugandan capital of Kampala. So, please, Collin Fair.
Hello, so I'm Collin Fair. I'm from the University of Waterloo, and today I'm going to give what's hopefully a complementary talk to what Katharine's talk was on sort of a more technical perspective, like lower level, more, might appeal more to the engineers in the room, but hopefully useful for everyone here on how you can actually, like at the end of this hackathon, you've got your great ideas, you've got your prototypes, how can you actually go from here to seeing it in the real world, getting used by people, making a difference? And I've worked at many startups. I tried counting them, didn't work. From classroom messaging, wearables, like I programmed the software on this watch, massive online simulations. I've worked at a lot of different startups, and I've started some of them myself. Some of them have made like hundreds of thousands of dollars, and other of them have made $0. So hopefully I have some idea of what works and what doesn't, and I can share that experience with you. And for engineers here, hopefully this presentation lets you avoid having your hackathon project, like Dr. Peck mentioned yesterday, that 95% of hackathon projects never go anywhere. Hackathon ends, project's dead. And hopefully I can, through this presentation, make people's projects here become one of the 5% that actually goes on. And for non-engineers, this will be like sort of a view inside, like what's going on inside the computer scientist's mind when they're developing a product. So you can understand the process. What the technical limitations are, and hopefully, like speak the language a bit when you're asking for features, or when you're asking, why isn't this done yet, that kind of thing. And a presentation, I'll break it down into 3 parts here. First is some advice on building your product. So this is something that you'll be doing during the hackathon, things you should think about then, in terms of like, sort of the technicals perspective, what can save you time, what can save you effort down the road. And after that is shipping it. So this is like, you have you getting it into the hands of users, getting it used, seeing if it actually is a product that people want, and then revising it, like the PDSA cycles that Katharine talked about. And finally, there's the scaling. So if you happen to find yourself with a successful product, how do you actually spread it? How do you make it something that everybody can use, that everybody is using, and how can you make it sustainable so that should you lose interest down the road, or move halfway around the world, get a job, graduate, the project can continue on going. So the first step here is building it, because you can't ship ideas, sadly, not yet. I'm sure somebody's like virtual reality, we could figure that out. But the real first step is the idea. And I think I saw yesterday a list of everybody's had their hackathon ideas, and it seemed like everybody was ready, but they figured it out. It was set in stone. But really, it's best to first come up with, find a customer and ask what. And by a customer, I mean either we're talking clinicians, doctors, maybe just regular people who have health issues, depending on what your app is. And if you can find them, you can save yourself a lot of time, because if you build a product and nobody uses it, it's kind of useless, and it'll make your life difficult. But if you can find a customer, and if you can work with them every step of the process, you can make sure that when they actually get the product in their hands, however long that takes you to write the code, that it's actually something that's useful, and it's something that improves their life, something that they want to use, and not something they forget about or never touch again. And when you're thinking about ideas, just another point is that there's competition, and I put this in because last night there's some discussion around the dinner table about it, like an app, and you could take a photo of your food, and it would scan the food, and it would tell you how many calories were in the food and the nutrients and stuff. And it sounds like an amazing app, and it would save a lot of time, because nobody wants to type, I had 1 bowl of cereal, and sort of manually enter your food. But if you could just snap a photo, it'd be great. And you might look at that as a hackathon project, and it's yeah, we can just Google image search it or something. We can figure this out. But in reality, this is an idea that's been tried before. They've dumped millions of dollars into it, and they haven't actually figured out. It's a very technically challenging problem. So if you go looking for competitors, if you find competitors, figure out figure out how you can do better than them. And if you don't find competitors, figure out, why are you really the first person to have this idea, or have other people tried and hopefully like published research and said like, this is why this idea didn't work. And then you can, when your idea is, doesn't mean that it's an impossible idea. It just means that when you do it, you need to say, we looked at these past, people, they made these mistakes, so we're not going to make them. We're going to avoid those problems. So step one, now that you've got the idea, you just write lots of code, but not actually. Because not everything needs a smartphone app. Like nowadays, everybody's, it's easy, I don't know, my phone's on the table there, I can't use it. Everybody's got a smartphone. It's easy to assume that everybody in the world has a smartphone, or, and everybody's on Facebook. And these are kind of bad assumptions to make. Lots of people, don't have access to these media, these channels. So when you're designing your solution, like hopefully you've got a problem at this point, but when you're thinking of what you actually want to use to solve it, you don't need to create a smartphone app necessarily. You don't need to create a social network. Like everybody wants a social network nowadays. It's hip and trendy and cool. Very, like everybody's got a social network. But in reality, like the example of the Line messaging app, you don't actually need to is it follow-up for ophthalmic surgeries? Yeah, so it was there's 0 lines of code. No, like you didn't even need an engineer to deploy this innovative solution, and yet it's probably going to be a lot more effective than if you had tried to create your own smartphone app or your own social network, because people are already online. People already know how to use it. People are comfortable with it, and this is just a logical next step. So it's nice to like focus on like the sexy technical solutions, because we're all engineers and we like fancy artificial intelligence, machine learning, whatever. But in reality, if you can solve the problem with a Facebook group, or with like SMS text messaging, or even just a website, as boring as websites are nowadays, very 2000s. It can save you a lot of time when you're actually developing your product, because you don't have to worry about spending time writing a smartphone app. And for the engineers, 0 lines of code is 0 bugs, sort of. You don't have to worry about maintaining a product that you never actually wrote. So the real step one is to recycle existing technology. Like I mentioned, Line, WhatsApp, because your idea will most likely fail. You don't, like, there's 95% statistic, as much as everybody would like their idea to go on and change the world. Reality is probably not. So when you're designing an application, if you've made the step to say we're not gonna use Line or WhatsApp or Facebook, we're gonna actually write our own code, write our own application. You often have the choice. Do we want to like sort of assemble? Like there's lots of frameworks. I think like React, Bootstrap. I'm sure this means nothing to like half the room if you're not like computer science engineers, but these are all sort of toolkits that you can plug together, you can assemble, and you create like a very respectable cross-platform application. There's no need to, for a lot of applications, there's no need to like start from scratch, especially in the hackathon phase, when we've got 2 days to be writing these applications, 2 days to be finishing our entire project. So if you can find existing technology and sort of snap it together, it saves you time now, and down the road when you're actually testing your application with users, you're piloting it, you're getting feedback, you can easily like take it apart and put it back together again slightly differently using these frameworks. And from like a technical perspective, I'm sure there's lots of people who've written Android apps here. I'm sure there's lots of people who've written iPhone apps. I would make the case for writing websites, because websites run on everything, and it's a lot easier to get started. You don't need an Apple developer account. You don't need to download Android Studio. These are the kind of considerations that you use when you've got a 48-hour time span, and that later down the road, if you need to, you could write a native app for each platform. But for now, if you want something that can work everywhere immediately without any without additional work, there's an easy route. That's aspect of the flexibility and cutting the right corners. Whenever I've been to lots of hackathons, and this is always my first step, is I write like a website that pretends to be a mobile app, because it means that if something's broken, I can type it, refresh the page in it, and it's updated. I don't have to worry about even reloading the app. And in terms of this is sort of I think the trendy phrase is the minimum viable product, is that since at this stage you've got your customer and you've got an idea for a product, you've written some code, but you don't actually know if it's going to work yet, and chances are you'll probably have to change some things. So don't finish the product, don't do everything, just leave if you don't need it right away. If the feature isn't a core aspect of the application, you can just not do it, ignore it, forget about it for a while, and worry about implementing it later when the customer asks, well, I clicked this button and nothing happened. You're like, oh well, we didn't write that part of the application yet. And when I say fake it is required, there's lots of technical problems that are they take time to solve, and more time than 48 hours requires. So maybe you're doing some sort of artificial intelligence or machine learning, or even just you had a really complicated app with a lot of screens that you had to program, and you only got to half of them. It's possible, especially at the hackathon stage, to fake it. So rather than having your perfect artificial intelligence that, I don't know, maybe you snap a photo of some sort of skin condition and it automatically analyzes it and tells you if you should go to a doctor. That's a classic health application that I think a number of people have tried with varying degrees of success. During the hackathon, you might not actually have all the data to work on the machine learning. You might not have the artificial experience or the artificial intelligence experience. So you can just have a human at the other end clicking yes, no, yes, no, and obviously if this were to be deployed, it would be a doctor reviewing the images and deciding whether it's a serious medical condition or not. So you can worry about scaling that later after you've actually proven that the product is something that people want, which is the subject of the next section, because sometimes what the customer tells you is not actually what the customer wants. Pretty sure that's all the time. The finding your market, there's a lot of text here and you're not supposed to read it because traditional startups are marketed really completely differently from e-health applications. A traditional startup, you post it on the App Store. I launched a startup with a Reddit post once, it's $0 advertising budget. And that's not something you can really do with most electronic health applications, especially if they're getting marketed to doctors and clinicians and hospitals and stuff, because the hospital administrator doesn't open up their iPhone, go on the App Store, search cool health apps 2017, and download the top results. It's just not something that they do. Instead, this is where having that customer lined up that you've been working from since the beginning is really good, because you can say, hey, that cool application that I told you I was going to build? Well, here it is on your phone, go try it out. It's not impossible without a customer. You can go to a medical, professional conferences and have set up a booth or something, or publish in magazines, or I don't know, other things. I don't really have much experience in that. I'm sure it's possible, but especially in this situation where we've got the medical professionals and the technical people in the same room together working on the same teams, you've already got a connection, you've already got a foot in the door, and there's no reason you shouldn't use it, as that's your customer number one, the first person who's going to use your product. And this is, I think Katharine did a much better job of describing the sort of the prototype iteration process than I did here in my single slide. It's just that bad is the status quo for electronic health technology. You open up your Windows NT laptop and the command line interface, and it looks like you're hacking into some 1980s mainframe kind of thing. It's very old-fashioned, and people are used to that, especially if they already have some EHR experience with that kind of system. So it's entirely possible that you'll give them an application. You've got your customer, you wrote the code, you put it on their phone, and they use it, and they're like, well, it's not very good, but nothing else is also good either. So they have this is what they expect. So this is where you can proactively solicit feedback. And here, I've just got a couple of very specific things, user studies. It's not a very complicated thing to, when I say this, I mean put the app on their phone and look over their shoulder, taking notes as they're using it. If they get confused at a point, if they if they ever make a mistake, if they click the wrong button, you can note that down. Then later, once they're done, you can ask them, why did you make that mistake? And especially if you can actually follow the person around as they're doing their daily rounds in the hospital or through the clinic or what have you. You can ask them. Actually, you shouldn't interfere with them. I should say you don't want to be walking through your application, but you can observe is this application actually making their life better? And because they might not tell you the things that are wrong with the application, they might not even realize the things that are wrong with the application. They might just be it feels bad, it feels slow, it feels hard to use, and they wouldn't they're not an expert in the area. They just don't really like it. And if you're the one who's made the application, you can say, oh, I put that button in the wrong place, or oh, I think that that window should come up earlier in the process, not later, or something like that. You can translate their sort of general disappointment with the application, which will certainly exist somewhere, into an actionable item for your next revision. And this is an area where technically you can be prepared, because if you've got an application that's easy to push out changes, if it's like a website especially, because websites you can just be push out the changes, reload the page, and it's there immediately. You can really impress customers, because this is not something that they're used to. They're used to software that takes there's an update every month. But if you can show up and you're eager to demonstrate that you're eager to help them, and you can actually prove oh, you've got a problem, type away, refresh the page, now the problem is fixed. That can really help get buy-in from people who have traditionally not been as enthusiastic to adopt technological solutions, just because of past bad experiences with them. So in this regard, if you're publishing apps on an app store, it could take a couple days to turn around an update. I think Apple's review process is faster nowadays, but it's not instant. Google, I think it's a couple of hours, but websites you can deploy updates instantly. So anything is better than, well, we'll fix it next month. That's not what you want with this. And communication channels, if you can actually, I talked about walking around the people through the hospital, following them, that might not be feasible in a lot of cases, probably. So if you can have Slack or email, Line, WhatsApp, text, FaceTime, whatever's the best for your user, whatever they're most comfortable with, that you can provide them support over is really important for gaining this feedback that they're not going to just tell you. They're not going to do it of their own volition. And this is not specific to healthcare at all, but the customer isn't always right with healthcare. You've got to walk this fine line, because on one hand you've got your amazing new solution. It's drones and virtual reality and artificial intelligence and all sorts of crazy stuff. And on the other hand, you've got what your customer is what your customer is familiar with. So at some point in between there's the sweet point of just enough innovation to actually improve their practice, whether if you're selling it to customers to improve their health, or if you're selling it to doctors to improve their treatment of people. And on the other side, there's something that's way too foreign. And this is especially in sort of entrenched, probably more Western healthcare applications, where people are used to the way things are because they've done it for 200 years. You can't rock the boat too hard in that regard. So this is something that it's case by case. Whether if the customer says, I want X, and you might think inside your head, you're oh, that's actually a terrible idea. But in the reality, this is the customer, they have the money, or they have the access. So you probably want to at least satisfy them to a certain degree, to the degree that you can stand. And finally, at this point, this is where projects fail. This is where you discover that actually I've got this great product. I thought it was amazing. It won the hackathon. This is the story that I personally have gone through, because I had a hackathon project. It won a hackathon. It was the United Nations too, so it's fancy. And then as months pass, and it turns out that it's actually not a very good idea, or at least we couldn't prove that it was a good idea. It might have been a good idea, but it's important. We talk everybody, I don't know, not everybody here, but a lot of people here are engineers, and we're all about the technical solutions. We're we're like, how can we use artificial intelligence and all this fancy technology with the latest version of JavaScript or whatever. Like we're focused on the technology side, when in reality, like when you're walking around, let's say you're walking around with your customer and you're watching them use your app that turns out to be actually terrible, but at the same time you notice, like, hey, every morning they hand fill out 100 forms. And then this is where you suggest to them, hey, that virtual reality drones, whatever crazy nonsense I came up with, forget that. But I noticed that you print off 100 forms and hand fill them out every day. What if I wrote you an application that did this? And this is where like the simple things, the easy wins, I think it was mentioned like the low-hanging fruit at some point. If you're like a lifelong doctor, a clinician, you don't really have technical experience. You don't actually know what things are easy and what things are hard. So once you've got an engineer in the room who can say, oh, hey, that's actually, forget our original idea. This is actually a much better, a much simpler idea. And this is something that can actually, more tractable problem that can produce a real impact. So that's why I say keep the doors open. Like, don't be like, they didn't use our product. We're never going to talk to them again. It's not the attitude to go in with it. You can use your connections and use your relationship that you've fostered over the course of developing this product to hopefully continue to work on other innovations that might actually work. Because the reality is a lot of these just don't work as well as we had hoped. And finally, let's say that you do luck out. You're one of the 5%, the hackathon projects that actually goes somewhere, doesn't die after the week is out. Not every hackathon project will have 1 billion users. That's why I say Google buyouts are optional. Like, that's the Silicon Valley kind of thing. You start a startup, you get 100 million users, 1 billion users, everybody's on your app, and then you sell it to Facebook, or then you sell it to Apple or Google or whoever. Like, that's cool if it works. It's worked for maybe like 7 companies, but you're probably not going to be one of those 7. So in reality, you have to dial back our expectations here and say, like, first, if you got a successful product, how, should it become the next big thing? How feasible is it to actually scale up? Is it something that you can just, is it something that 1 million users could use tomorrow and everything would keep on running smoothly? This is more of like a technical aspect, and that not all products are scalable in the hip modern sense. Like, if you walk into like a normal tech startup and say the word scalable, they'll think like, more servers, more power, more databases, more connections per second, more queries, whatever. Like, it's a very like technical, concrete thing. But the reality is a lot of products scale with humans. So like, there's a number of health applications I know, and I worked at a company that has one of these, where the scaling is human. There's human coaches sitting at computers typing messages to other humans. So if we want to have more customers, we have to have more coaches. And this is a very viable, like, it's not hip and trendy. It doesn't sound good on paper. It's not as cheap as just adding more servers or paying Amazon Web Services a lot more money. But scaling with humans, with call centers, with chat operators, with like Amazon Mechanical Turk, it's a very viable option. It's just you have to recognize that that's what you're going to do should your product become, insanely popular. And just the last point is more of sort of, I'm not actually sure if this has ever worked, but you can, if you have some, like I was talking earlier about the AI product where you'd snap a photo of like some skin lesion or whatever, and it would automatically determine whether you needed to go and see a doctor. That's something that it's a very hard problem, and it's not something that you'd, for ethical reasons, obviously, you wouldn't want to hand it over to a computer right away, because the computer would make all sorts of mistakes. You never actually want to, I wouldn't trust that application. Whereas if you have something like that, you might consider starting off when you're, and this isn't something you'd view at a hackathon particularly, but it's something you can write down in your business plan that you show to the judges. And if you start off, you could have like human reviewers. They're looking at images and they're like, yeah, that's a terrible cancerous, lesion that you need to go and see a doctor right away. And on the other side, no, that's actually completely harmless. You don't need to worry about it. You can start off, collect this data, and then once you have 10,000 images, 100,000 images, however many images in this particular example, however many samples you need speed, you can then work on machine learning, artificial intelligence to launch it to your billion users, whatever your target is for your full deployment. That's something that is James here? James should be here. James is the AI expert. He's running a workshop this afternoon. So if you're interested in artificial intelligence, hit that up. But I don't know much more than that. And finally, marketing. I mentioned this earlier. You can't market e-health application to doctors in the same way that you can market it to consumers. Like consumer marketing, there's already I don't need to present on that. There's already a lot of resources out there. But for doctors and hospitals and administrators and governments and all of these sort of institutional, I guess is the term, customers, it's not something you can put on the App Store. So I'd say professional networks. And by this, I mean if you've got, let's say, back in step 2, we had our customer, they're using our product, it's successful, they really like it. Then that's when you step in and say, hey, this product that we made for you, it's made your life easier. Have you told anybody else? Who else do you think could benefit from this? Ask for contact details. Your customer is probably not going to be your marketing department. They might not be going out and singing the praises of your application to all of their friends, but they'd be willing to tell you and say, hey, I know Dr. X or Dr. Y or this hospital is looking into something like this, and that's when you can step in and say, hey, it's worked for these people. It'll probably work for you. You should give it a try. Here's the application. Download it. Try it out. And sustainability. This is, I guess, not something that's really a hackathon concern, but down the road, you have to realize that even if you're super invested in the application, you're like, I'm gonna, this is my love of my life. I'm never gonna do anything else other than this hackathon project, which is probably not the case. But hypothetically speaking, if that were you, have to realize that sometime down the road, the novelty is going to wear off. You personally don't want to maintain the application forever. You don't want to be writing the code and paying for the servers and doing the marketing and doing all that stuff. So you have to, the 3 key questions of sustainability in terms of just startups in general is who owns it first. Once your interest wanes off, who will be the administrator of the system? Who will be cutting the checks, writing, paying the bills, managing the development of it? They don't necessarily have to have technical abilities. So this could be like a government agency. It could be an NGO. It could be a separate company that you set up if you're really successful. They don't have to be the original developers. They just have to be invested in the project financially and in terms of interest, so that they can continue its success into the future. And that also ties into who maintains it, because somebody has to write the code and the servers break. Somebody has to fix them. And finally, who pays for it is always the big question. Is that again, the modern startup approach is to get 1 billion users and sell yourself to Google and then live on a gold-plated yacht in the Caribbean and never worry about anything again. But that's not something that's going to happen for most startups in general, certainly most tech startups. So you have to ask yourself who's going to actually be paying for it. And I think the most obvious solution, or at least the classic solution, is get an NGO to pay for it, or get the government to pay for it, because governments are in the business of having healthy citizens. So theoretically, they should be more than willing to pay you money to make their citizens healthier. And the same for NGOs. But this was a question that somebody asked yesterday, is how do you actually get a government's attention? How do you go up to the Minister of Health and be like, yeah, we've got this cool app that you should pay us a lot of money to deploy in your country? I've never personally done this, but I can say this is where I mentioned the project earlier that failed. This is where that project failed because it was cool, it worked, it was technically feasible, but we could never actually prove that it would have a difference, that people would actually implement it in their lives. So when you're considering, and this is important for investors too, if you're trying to get venture capitalist funding, they want results. The honeymoon period of anybody walking up to them and say, hey, we've got a website, and sort of getting a lot of money, that's worn off. They've realized that there are effective applications, there are effective technical interventions, whatever you want to call it, and there are ineffective ones. So now you need results. And this is something that Katharine mentioned, that was it SMART, the specific and measurable and I forget the rest, sorry. Yes, you have it written down in your notes because you're attentive. Yes, you want quantifiable results that are meaningful and something that you can take to someone. And this is if you've already got a customer, this is a really easy thing because you can say, hey, we've worked with Dr. X in Clinic Y, they've used it for 6 months, they've used it for a year, they really like it, it improves their, they've reduced their paperwork, like say it was some sort of paperwork filing thing that made filing government forms easier. You could say it's reduced errors by X%, or it's improved, it's saved them 20 minutes a day, and over a year, that's a lot of time. Like you can, as part of a distributed health record system, if such a thing ever existed.
I believe that many developers here and engineers agree that feedback is really important when developing some application. But the problem is when we work with e-health application, we have different type of customers and busy people like doctors. And how can we get face-to-face communication or feedback that can help us? It's pretty hard to get face-to-face communication with them anyway.
Yeah, so the question is, like, doctors are busy people. How do you make time in their schedules? And I think that's the $1 million question in a lot of not just getting feedback for your new app. Everybody would like doctors to have more time. So I'd say the answer, in lieu of a magic bullet for giving doctors 25 hours in a day or more, it would be try to make feedback as easy as possible for them. So like, just to talk on like a technical basis, if you've got like an app, you can integrate a feedback form directly into it. And it's not face-to-face, but maybe you could have like a little like video recording widget. So rather than having to type in while I was clicking this and I scrolled down, you could actually have it like, you click record and then you go through the app and then it's recording like the front camera view. So then they can explain what they're doing. And that way, if they're actually, if they're busy, they're halfway through some checkup and their phone crashed or your app crashed and it lost all the data. They're not in a good mood at that time. So if they could just click a button that said like something went wrong and it automatically reports all of this back to you and they can just continue on with no extra time. Like there are technological solutions like that can improve improve the feedback cycle. But I don't have an answer for giving doctors more time in the day, unfortunately.
So please don't give the doctors the product at the end. That's not the right time to get their feedback. They have to be part of the design process. If you're gonna try to pitch them to doctors, they have to be there from the start. They have to be part owners of the product. Like to me, that's what one of my pet peeves. They show me the product at the end. It's like I'm doing a post-mortem. It's dead already. And it's a waste of my time, it's a waste of your time. If you want the doctors to use your product, they have to be there from the design process. You can't give it to them at the end and I want to see your feedback. Like, there are more and more doctors who are interested in this innovation field. A lot of them are getting burnt out from seeing patients all day and all. To them, it's not as satisfying anymore. And a lot of them are looking into trying to innovate, trying to improve the way they deliver care. Those are your target doctors. The young doctors are your target doctors. You need to work with them from the very start.
Any more questions? If not, thank you very much, Collin. I'm sure we have more time during the break for more discussion and ideas. So we're going to have 15 minutes break. And please come back to the room at 11 o'clock. Please make sure if you finish your evaluation form, you can leave in front of the room. Thank you.
ยังไงอยู่นี่
ดูแลดีๆหน่อยเพราะว่าเขาเป็นหวานใจเป็น my sweetheart
โลขอเทสสไลด์หน่อยครับอ๋อตัวครับขอบคุณครับ
Yeah, you can use here or either here. Yeah. Yeah, this one is better. Yeah, maybe this one is better. Sensitive.
You heard about the power pose. You heard about the power pose. Yeah, but it's not even true. I know. I have a whole talk discussing all those refractive features. And you have tons of photos. Yeah, that's what no one likes to read, right? No, you have tons of photos from the kickboxing. Oh, really? Can I see? I'll share it Dropbox. I think I just got this share on Dropbox. Yeah, I'll put it up there. I just made a lot of changes. Hello?
ทดสอบ1 2 3 4 5 6 7 8 9 10 11 12 13 14 15 16 17 18 19ทดสอบ1 2เบานะครับ1 2 3 4 5 6 7 8 9 10 1 2 3 4 5 6 7
I use this? Hey, good morning.
Are you still Thai pronunciation?
Sorry?
Are you going to say that?
No. Maybe I'll call on you to say it. I don't think so. I could get the first part, but not the second part.
Right.
Yeah. Okay, sure. Can I drink this?
So let's start with the final lecture of the boot camp. The final lecture is about the creating a culture of entrepreneurship by Mr. James Weis. James has founded and led several initiatives aimed at increasing the pace of innovation within the life sciences and healthcare industries. As a president and founder of the MIT Biotechnology Group, the first MIT student group dedicated to building relationships between academia and the biotechnology industry. He oversaw growth to more than 1,500 members in under 2 years. James also organized the life science division of the MIT Alumni Angel Group, which connects MIT-affiliated life sciences startups with alumni investors. James is currently completing his PhD in the MIT Computational and System Biology Initiative, where he develops artificial intelligence methods for the design of next-generation biocatalysts. In his spare times, he enjoys motorcycling, martial arts, including Muay Thai, and salsa dancing. Everybody, please welcome James.
Thank you very much. Speaking of Muay Thai, we had the opportunity to go train briefly yesterday. So that was, I'm still sore. So first of all, I want to thank KKU staff and all of those attending. I felt incredibly welcome the past few days. I'm very appreciative of that. And I'm really looking forward to seeing what happens in the next couple of days. So my talk is titled Creating a Culture of Entrepreneurship. But most of us here who are not medical doctors are engineers, so today we'll talk about engineering culture. So I want to begin by outlining the current state of the world for entrepreneurs and people who are interested in innovation. The overall message that I want to talk about in the next couple minutes is that there's a confluence of trends that are reducing the barriers to technology entrepreneurship all across the world. So it's very high level, but just stick with me through this and then we'll get into the more details after that. So the first thing I want to touch on, for example, and I'm sure many of you have seen this, is that much of the world has access to unprecedented amounts of computing power. So the phone in your pocket, I'm sure you all have something along these lines. This is over 1 million times more powerful than the computers that brought people to the moon. So that's incredible. Hard drive capacity is similarly keeping pace. As Leo mentioned, you can now store more things than you need in a small thumb drive. In the life sciences, which many of us are interested in, the number of published genomes continues to increase exceptionally rapidly. And the cost of obtaining these genomes has gone from $3 billion to about $1,000. Anyone with internet access now has, every day, can access more information, this is a chart of Wikipedia, than has ever existed before. So every day that you're alive, you have access to more information than has ever existed previously in the history of humanity. And the number of devices that are taking advantage of these changes is increasing extremely rapidly, including cell phones, smart devices, etc. So all of this is to say that we live in a uniquely exciting time. Information, technology, tools, and connectivity allow innovation in a way that is unprecedented in the history of humanity. And this innovation can and is making our lives better, healthier, and making us live longer. So this is all very exciting. But I think one mistake that is often made is thinking that because these resources are available, innovation is an inevitable consequence. And I would like to say that is absolutely not the case, and this is where culture comes in. So, I tried to memorize this, and I wanted to speak it. I've been practicing all morning, but I can't remember. So can anybody translate this for me? MC?
คอนเฟิร์มภาษาไทยก่อนมันแปลว่าคนทำผิดคนเดียวผิดไปหมดทั้งห้องใช่ไหมฮะ In English
Yeah, in English would be, yeah.
it's only one person in a group did something wrong, the entire group would be in trouble.
So I think what it's talking about is smelly fish,
Yes.
ruining a barrel of
Well,
fish.
I didn't literally.
Right. Okay, so thank you. So I want to talk about this fish being culture. So you can have everything. You can have access to unprecedented computational power, hard drive space, access to information, everything that you need. But if you don't have a culture that is conducive to facilitating innovation, then the whole barrel of fish is ruined. And I think this is often overlooked. So the question becomes, if you have all these resources, how do you engineer a culture that is conducive to achieving what you want, to increasing innovation in whatever area that you're interested in? So how do we engineer culture? I think we can begin with the same steps as in engineering anything else. So we list the problems that we have, what's keeping us from achieving the level of creativity or innovation that we want. We design a solution that addresses each one of these problems, and then we just keep going as engineers do until we either succeed or we just give up. So I'm going to phrase this whole project in terms of a problem that I've noticed at MIT, which is the lack of innovation in biotechnology. So the first step is listing the problems. So I'm going to go through 4 different problems that I've noticed at MIT, and then after this we'll discuss how we address them. So the first problem that is impeding innovation in the biotech sector, at least at MIT, is that academics and students do not interface with each other. There's not communication between different fields, and there's not communication between industry and academia. So as a result, people in one field do not understand the problems of people in another field. They don't trust each other because they don't work together, and they don't understand how to work together to build new technologies. And as things continue and the world becomes more and more interconnected, working at the intersection of all these different fields is critically important, I think. The second problem is that there exists these, what I call superstar connectors. So these are a few people that are kind of trusted to interface between the academic world, between research, and between kind of venture capital and investment and creating new startups. So these people benefit from being in this position. They're this only channel through which this can happen. So it's great for them, but it's very bad for everybody else because everyone else has to go through these few channels. And these people are mostly professors and venture capitalists with very deep networks. So if you're not connected to one of these people, your chances of success is extremely diminished. A third problem is that there's a very serious funding gap in the US. And I've heard a little bit about the situation in Thailand. It seems like it's different, and I'd love to hear more about that. But in the US, you have this problem where there's basic research, and then there's applied research, which is typically kind of venture capital funded or something along these lines. And then in between, you have no source of capital. So, and these venture capitalists are kind of slowly trying to go earlier, and the NIH and public funding agencies are trying to go later. But for people trying to launch, for example, new companies, especially students who don't have access to lab funding or other sources of capital that can kind of span across this, because traditionally you'd have a professor here with new technology that would raise grant money ostensibly to work on developing that technology, but really he's working on crossing this chasm. And then he goes and talks to the venture capitalists. And that's fine if you're a professor who has access to this information and to this capital, but if you're a student, you don't. And I think that that is a serious problem because you have lots of students with interesting technology, with interesting ideas, who are very motivated to do this, more motivated than professors are, which I'll talk about later. But the funding for them is not available. And the fourth and final problem is a mismatch of incentives. So professors are not incentivized at all to work on commercialization, except to the extent that they want to make money. But they're incentivized to be professors, which is good. That's their job. But students, many students are very interested in entrepreneurship or interested in innovation generally, and they want to get involved, but they're taken advantage of. So, you have some venture capitalists like this and some poor student who came up with a great idea, did his PhD, worked for 6 years to come up with a new technology, and then ends up working for a company based on the technology that he started for substandard salary and almost no equity in the company. So where's the incentive to put in the work necessary to really create something exceptional? Okay, so we've outlined the problems. The next step is designing a solution to these problems. How can we look at what currently exists and manipulate it to be something that is what we would prefer? So roughly 2 years ago, as an attempt to solve these problems, I founded the MIT Biotech Group. And our high-level goal is to, quote unquote, increase the pace of biotechnology innovation. And I think the MIT Biotech Group is relatively successful in solving the earlier problems. So I want to go through how we thought about addressing each one of those, and then I'll talk in more detail about a few of our projects that I think are pretty interesting. So the first problem that I mentioned was the lack of communication across disciplines generally. So we've addressed this lack of communication by really forming ourselves as the central hub for people interested in this area to come to meet with us. So we're really like the central hub for biotechnology and industry at MIT, and we actively seek out members. We don't kind of have a home in one of these departments. We exist independent of all these departments, and we actively seek out collaboration with all these departments, which is surprisingly hard because once you develop something that is valuable, every one of these departments wants you to be part of their department. So you really have to put the effort in to be department agnostic. The second problem was the existence of these superstar connectors. And the way that we're addressing this is by effectively building a deep network between MIT and between the surrounding biotech ecosystem, and sharing connections openly and freely amongst this network. So now that we've interfaced with all of these companies, which are some of the more influential in the area, and then and many others. And it's very easy now. If you're a student and you want to get connected to someone at Pfizer or someone at Merrimack, or you want to learn about the technologies that are going on in these different areas, you can come to us, and we know people at all of these places. So we can very easily introduce you to these companies, which really removes this guy. So this guy is becoming less and less important. They're still, very important, but our goal is to get rid of them entirely. Something else that I've spent a lot of time working on is this funding gap. So we have a couple of initiatives focused on this, and I'm going to go into 2 of them in more detail. But briefly, we founded a MIT alumni angel group, which is successful MIT alumni who have area expertise in healthcare or in biotechnology and are able to evaluate very early stage companies who have the necessary expertise to understand what the technology is doing. And then they fund these companies that are founded by student entrepreneurs. So that benefits them in terms of capital, and it also benefits them in terms of advice and connections, and really works to kind of democratize this whole process. The other thing we're doing is working with MIT to offer no strings attached grants for student entrepreneurship. So we have a program right now called MIT Sandbox that we're working with that gives between $5,000 and $25,000 to students with new ideas. Much of them are in tech, but a lot of them, especially for the higher amounts, are in biotechnology and healthcare. And these have we've had, I think, 3 or 4 companies already who have won these grants and who are currently commercializing, and now they've crossed somewhat the valley of death here, and now they're in the process of talking to VCs and kind of scaling up. And the third thing that we've done is created a what we call a venture capital due diligence group, which is effectively a group of students who are interested in learning how to evaluate companies. They maybe want to be entrepreneurs, they maybe want to be investment professionals or venture capitalists or something like this. And they take their expertise as PhD students, they work with, and they build reports on companies that are seeking funding. So that decreases the amount of domain expertise necessary to understand what the company is doing. And as a consequence, the amount of people who are able to fund that company expands from domain experts to kind of more general sector experts. So the effect of all this is to try and fill in this hole here. The fourth problem that I talked about is mismatch of incentives. So the way that we've addressed this is through kind of a unique structure of the organization that I think has really been important in our success. So we have a relatively flat hierarchy with one group of people, what we call the executive team, that manages resources and it kind of manages the club from a high level, make sure we're putting our efforts in areas that are important, interfaces with the administration of the school, etc. But then we have a second kind of like tier, not really a tier, of project leads. And these are either students or faculty members who approach us and say, I think that this is a problem, X thing is a problem, and I would like to do Y thing to solve it. And rather than taking that advice and then thinking about it and then potentially coming up with our own solution, what we say, and we do this once a week, we have an open call for people who are interested. We say, come to our open call, pitch your idea. If people are interested in your idea, then they'll work with you, and we'll devote resources as necessary from the organization, which allows us to scale very quickly to new ideas. So when we have an exciting new idea, many people are interested in joining. The people who join are able to learn about a new area or develop some expertise that they didn't have previously. And the people who lead the project are able to kind of be a project lead. They meet with people who are influential in the areas that they're interested in. So the incentives are much more aligned than in a normal organization. And as these projects develop, resources are kind of gained and lost in accordance with their popularity. So it's kind of like an elastic cloud computing type of thing. So these were the solutions that we designed at the MIT Biotech Group. And I want to talk briefly about a few of the successes that we've had. So in fact, when we first launched, there was myself and 3 other graduate students who thought this was a serious problem. And we wanted to announce our launching, so we held a kickoff event with some of our friends, and we expected roughly 50 people. We reserved a room for about 50 people. And little did we know how big of a problem this was. We had, I think, over 300 people line up to enter this room. So this is a line of all the people who have never heard of us before. All they heard about was that they're creating an organization to kind of connect academia and the biotech sector, nothing else. And all of these people were interested and took time out of their day to come. So I think that was an indication of a very strong latent need for something like this at MIT, and then I think generally this problem exists in most places, actually. So when the KKU delegation visited MIT, we had about 1,000 members, up from 4. And now we have over 1,700 members. So I think we're the largest organization at MIT, and we have over 30 people who are actively involved in leading the separate projects, including some of which who are now faculty members at MIT or who actually were hired and are supported by some of the departments solely to give us support. So we've launched many initiatives. Because of the structure, I think, we've been able to launch many different initiatives, all of which are aimed at increasing the pace of biotechnology innovation. And the amazing takeaway from me by being part of this, the most notable thing for me was that if all you do is lay the groundwork, make resources available, and make connections available, and then just get talented people who are motivated and incentivized to do well, these amazing projects just kind of arise out of nowhere. You don't have to sit down and strategize and plan everything. You just create the environment and people will come and create amazingly impactful things. So most of the things that I've talked about here, I have the pleasure of going around and talking about them and kind of claiming them as my own success in some ways, but really I've done very little except kind of lay the groundwork. And then the people who have really launched these things have put in enormous amounts of work and built up entire teams to continue each one of these processes. So I'll go into detail for the first three of these, but briefly, some of the things that we've launched include an online report for the Boston area biotech community for students with advanced training in the area to get them to understand and learn what is happening in that area. We've launched several new courses, one of which is research experiences in biopharma, so it's a new educational model for gaining experience in industry. We've launched the Angel Group, which I touched on, the Venture Capital Due Diligence Group. We've launched in partnership with Novartis a drug development simulation where Novartis actually came and walked a group of us through how to develop a drug and what the steps are at each along that process. We've launched a kind of like a translational biotech seminar series. So another group of people looked at the curriculum at MIT and looked at what was necessary to be successful in healthcare and identified the areas where there was not overlap, and then invited people from the local community with expertise in each one of these areas that wasn't present in the MIT curriculum to give a talk. So that's kind of complementary to MIT curriculum. So the first project that I want to discuss is Synapse. It's an online news source aimed at exposing students to the biotech industry. We're a bi-weekly report on the Boston area biotech scene for students who have advanced training in life sciences. And there's really three things that Synapse does. They have interviews with local entrepreneurs, successful CEOs, et cetera. They've gone across the local MIT area, the Boston area, the Cambridge area, to identify startup resources that are available that many people don't know about, and they've compiled them. And then they also go around and interview specific companies and kind of gain information about each company and share that information. So for the spotlight interviews, which are the most popular, Synapse sits down with successful biotech founders, CEOs, entrepreneurs, and brings you stories and advice for success. I didn't think this would be very popular, but apparently, actually, it is extremely popular. People like to learn through osmosis what other people have done. Like I mentioned, they have startup resources and company profiles as well. And so you can actually go there now, synapse.mit.edu. This is our website. Second thing that I want to talk about is a new course that we've launched called Research Experiences in Biopharma. And this is a unique course that connects academia and industry in a way that I don't think has happened before outside of maybe computer science. We call it a new educational model to give students hands-on industry experience. And the way that we came at this idea was we conducted a survey of our members and asked them what would be most useful for you in your career ambitions, or as a student with the interest that you have, what do you wish MIT offered you? And this is the results here. And the number one result was, with over 43% or something like this, would be extremely interested in taking part in a part-time internship during their studies. However, there's serious barriers to this. I don't know if these exist here as well for PhD students, but advisors generally do not like when you take time off and go work on an internship. They would prefer you to be in the lab working on their technology for their own future company, which you probably won't get very much equity in. And then there's also funding restrictions, which are just kind of like a logistical issue. As a student, you're funded by the university. If you're working somewhere else, how do you deal with that? So the way that we addressed all of this was to create a course. This addresses the funding restrictions because course enrollment doesn't compromise funding. You can sign up for a course as a student, that's why you're a student. And And then we offer this for free to companies. So the students don't get paid. The companies don't have to pay anything. It's purely an experiential course, which alleviates the funding restriction. As far as the advisor attitudes, advisors are much more comfortable with the course. You know, they live in the academic system, and their students take courses all the time. It has a clear, defined, manageable time commitment, and it's accessible to students across fields because you can sign up for a course in whatever area that you're interested in. And there's other added benefits as well that we've started to see materialize. MIT gains partnership with many of these organizations, and actually many people in MIT have now come to us and asked us to introduce them to some of the companies that we work with here and kind of facilitate and increase that connection. And then we also have we actually have a course as well besides the internship once a week, and students can meet other students that are interested in this area. It's an opportunity to kind of like network generally. So the way this course was structured is as a 12-hour-a-week course with 10 hours a week on-site research experience, 1 hour a week class, and then 1 hour a week homework, which was basically just writing up about your experience. And we've worked with, so far we have students who are doing internships at Amgen, Merrimack, Novartis, Pfizer, and 2 local venture capital companies as well. So the final case study that I want to talk about is the MIT Alumni Angel Group, which is, I talked a little bit too much about earlier, but it's providing early stage expert advice and capital to entrepreneurs. So the way that this works is we found successful MIT alumni with experience in healthcare and life sciences. They tend to be ex-entrepreneurs, executives at pharmaceutical companies or something along these lines, or they're professors who have done this before or are interested in doing this. And then we have aspiring MIT students and alumni entrepreneurs who are met with the problem of not being able to raise enough money to cross that valley of death that we talked about earlier, in addition to being viewed as young entrepreneurs, which in the healthcare and life sciences industry is not a cool thing like it is in maybe computer science. So having some people with serious experience in the area is really beneficial. We've identified, I think we have over 100 MIT alumni angels now, and we have had something like 10 companies be funded through this process. And keep in mind, this was only launched like 6 months ago or 8 months ago or something along these lines. So it's having a real impact. Okay, so I've reached the conclusion. I might have gone faster than I should have. But overall, we've outlined barriers to innovation, outlined the process of creating a culture that is conducive to creating the innovative atmosphere that you would like. The barriers, in my case, were lack of cross-disciplinary communication, the superstar connector effect, the valley of death funding gap, and the misalignment of incentives. And then we engineered an organization that touched on each one of these projects in a way that was scalable, free of bureaucracy, and had incentives aligned. So people who participated were incentivized to participate based on their interests. And this organization has created a culture that encourages the launch and development of these new projects, some of which I just talked about. Right, so the conclusion for me is that culture can be engineered, and that it is worthwhile to do so, and that the results can be surprisingly impactful when done correctly. So that's it. I have plenty of time for questions, which I think might be more useful, actually. So thank you. Yes.
So if you were to try to implement an idea like this at Khon Kaen,
Yeah.
what would be some of the things you would do the same, but what would be some of the things you might do differently given their current situation?
overall?
Yeah, I think I was hesitant to provide suggestions for Khon Kaen in general because I don't think I'm aware enough of the unique situation here. But I think the steps that I outlined in general are applicable kind of across areas, outlining what exactly the problems are and then addressing them, creating an organization that addresses them. I think the solution of creating a independent entity that has advice, access to people that are influential in these areas, but that has enough funding to exist independently and that is created by students and faculty members who have a strong interest in this area can be, I think that is a very powerful solution. And I think as long as it's maintained in a way that's, at least my experience has been, bureaucracy free and kind of has a central meeting where people are able to give ideas and then kind of decide which ideas are worth pursuing and which ideas are not, I think that can be very powerful. Yes.
I'm interested to see what was the reaction of the superconnector people.
Yeah. I don't think we're their favorite. I generally don't talk about the superstar connector when I talk at MIT. I avoid that because often they're in the audience or people from their lab are in the audience. And it's not so I don't think they're really aware that we view them as an impediment to innovation. But I think that they really are, actually. And I think if you're, especially being a PhD student and having experience and gone through this entrepreneurial process several times and have many friends who have gone through it, it's almost if you're not connected to, at MIT, it's like Bob Langer or Ram Sassi-Sakran or a few people like this. It's very hard for you to gain access to capital or advisors or things like this, even though their involvement in these companies is almost nil. I mean, they're advisors to like 100 different companies, so they don't actually go to the meetings or do anything other than just stamp it with their approval. So I don't think that if they heard this, their reaction would be very positive, but I think it's the truth. So, yeah.
My name is Nasapon Tanti Manchachai. I'm studying at Computer Engineering of Khon Kaen University. We study the theory for 4 years. How do we apply them practically? What factors are important for us to be an entrepreneur?
Yeah. Well, I think working in computer engineering, you have a big advantage because the culture of computer science, I had other slides on this, but I took them out because I thought that they were confusing. But the culture, for example, in the computer science and artificial intelligence lab where I work, it's been very interesting. If you look at like maybe 50 years ago, if you talk to professors who had students maybe 50 years ago, the top students would go to big corporations that were prestigious, like General Electric or something like this. And kind of the worst students would end up working for startups because it was viewed as like a less sexy, a less safe career path, I guess. And now it's the exact opposite. So I think that's an indication of an area where culture has been extremely successful in changing. You can argue whether or not it's a lagging or leading indicator, but I think it's an essential ingredient of entrepreneurship in this area. So you get now the top students are starting companies and are joining startups, and the bottom kind of, not the bottom, but like the mid to lower students are going to big companies and things like this. So I would say just get involved and just start doing it. Yeah.
Thank you.
I think it's really great and exciting, the work that your group has accomplished. And first, I'd like to just highlight, I think the reason that you were able to avoid a lot of the bureaucracy and navigate between the groups is because it's student-driven.
Yep.
I think, as faculty members or professors, you're kind of locked into your department, and it's really great to see the type of momentum that you can build to cross departments, to cross schools, and bring all these groups together. And I just wanted to applaud you on that. The second question I guess I have and concern is, how are you navigating the TLO, the Technology Licensing Office? I know that as students, as PhD students, basically MIT owns everything that you produce, and I think that you're able to navigate the bureaucracy, but the lawyers will catch up to you.
Yes, that's true. That's definitely so. In regards to your first message, thank you. I think so I didn't talk too much about avoiding the involvement of professors because there are a lot of professors in the audience, and I didn't want to offend anybody. But I think being student-led it was a challenge at first because as a student, you're not taken as seriously as if you are a professor. But once you reach a certain critical mass, and once you actually do things, and once you have professors who support you, then I think it's a huge advantage. And I've actually had to fight frequently to avoid us being consumed by different parts of MIT. So the biological engineering department has tried to consume us. Several other departments have tried to consume us. So yeah, it's an important thing. I think you're totally right. And your second question regarding the TLO. So all of the things, I didn't go into too much detail about this, but it's a very important question, is navigating kind of like the legal boundary between what you can do as a student organization and how involved companies can be in the academic process, right? Because academics and industry are, for a reason, separate entities. And it's connecting the two has to be done very carefully, right? So we have kind of, initially we shied away from even discussing that problem. We just have companies come on board and we kind of just say we're facilitating communication. Even for the MIT Angel Group, we technically are not an angel group. We're like a meeting place where people will kind of meet and talk about things, even though we are 100% an angel group. But we've continued to lobby the MIT administration about this process because we think it's the funding gap, being able to raise a couple $1,000s, in biotech maybe a little bit more than a couple $1,000s to pursue your own idea and research is incredibly powerful. But just like I talked about, the incentive alignment, if you don't own your invention, then who cares, right? You're still working for MIT, you're still working for your professor, and the problem is maintained then. So we've been working on this a lot, and actually it's secret, so don't tell anybody at MIT. But just as of 2 days ago, I talked about the grant funding, the $5,000 to $25,000 grant funding. So we've supplemented that with a lab space that is now free for MIT students to access, and any technology that is developed in that lab space will be owned by MIT students. So it's, I think it's the first time that's ever been done at MIT. I'm not sure or where else, but I'm really hopeful that will kind of address the problem. Yeah.
So the superstar connectors, they do exist for good reasons, right? And one of those is that we all need to be able to identify someone as credible from the get-go, because we don't have much time to know about everybody, right? When we see a superstar connector, we can tell that chances are they are credible and they're representing something worthwhile.
Yep.
Let's get realistic, right? So if one of us had come to you before asking for your collaboration on a hackathon project, you probably would have thought, like, who's this person coming from a university with weird name and from this underexplored region of Thailand? I wonder if they have good food and good massage spas over there, right? So, but now that we have known each other, now that we have learned more about each other, we can see that we represent something worthwhile that we can tap into, right? So by creating a group of a lot of people that try to each connect to each other, I wonder if you can reach that deep level of connection or that level of credibility.
Yeah.
The same way that the superstar connectors have.
Yeah, so first of all, I 100% agree with you. I think they exist for a reason, and one of the main reasons that I think they exist is that sorry, I lost my train of thought by seeing myself. One of the reasons that I think they exist is because people who invest in these areas do exactly as you say. So they count on this person's, seal of approval as being a sign of a good idea, effectively. So personally, I've seen many of these companies. I do diligence sometimes for venture capital companies. I'm involved in doing that often. And a lot of the companies that are stamped with this are actually not that great, right? So it's just that some of them are. I mean, don't get me wrong, some of them are amazing. But if you have an amazing technology, people are going to be interested, I think. So I think the real problem is if you have an amazing technology, but you don't have the funding to get it to the point where you can show other people that it's a convincing, amazing technology. If that makes sense. And so that's why we're trying to address kind of the funding gap and bringing in people who have money to invest at a very early stage and kind of bootstrap the process in some ways until you get to the point where you can be credible and avoid maybe having to rely on these connectors. But that's not to say that I don't think we shouldn't have these people involved as advisors. I think you absolutely should. And I think once you have an exciting technology, you can go to a professor and tell him, I have this exciting thing, and you can kind of work your way. I mean, all startups do this, right? You have some kind of technology, or you have some people involved working on something interesting, and you just go meet a lot of people, and then some of the people buy in, and then as you get more and more buy-in, you get higher and higher levels of people buying in, and yes, it's more work. And I don't think you have to get rid of the connectors necessarily, but I would really like to see that connection be kind of like democratized. I think that would be conducive to having students feel more excited about working on new technologies. And I think honestly that we would just have better companies because I think the supply and demand is just, the supply is so high on the superstar connector side that a lot of subpar companies kind of like slip through. So, but I agree that it's a controversial statement, so yeah.
Interesting that you can have a sandbox and then some funding for the initiative. Could you explain more how you get that kind of funding? 5,000 and 2,000, 25,000, I think it's quite
yes.
Money too.
Yeah. So that's a good point. That has been, so MIT is launching a new program called Sandbox, and that's actually in collaboration with some of the local venture capitalists. It's kind of run at the provost level, at like very high levels of the institution, and the venture capitalists are providing the money. So I think it's 200 million or something along those lines. It's a significant sum of money, and there's no strings attached to funding except that the venture capitalists are able to, they kind of pick who gets the funding, and so through that they get exposure to the new technologies, and then also you're supposed to sign something saying if you end up becoming a billionaire, you'll consider giving money back to the organization. So I don't think anyone's become a billionaire yet, so I'd be curious to see if anyone does that. But that's how it happened. And this is a process so we've been fortunate to kind of tap into this. This is something that MIT is really interested in, and we, as one of the largest student organizations in this area, they came to us to work on this partnership together. Yeah. So, but that's the hard thing to do from scratch. Yeah.
Thank you for your lecture. I am a lecturer from the Department of Computer Engineering, and I am particularly interested in the course that you mentioned. I'm not sure whether I understand it right, but is it like a course that makes students solve like a real world problem from the companies and then kind of like try to push them into products or something like that? Maybe you can you explain more about the course, and is there any interesting or useful feedback from the students who have taken the course, and what problems did you face while you ran that course?
Yeah.
Thank you.
Sure. So your first question was in regards to the process of the course, right? So The course is structured as a part-time internship and as well as a classroom section. So you spend almost 10 hours of the 12 hours allocated per week, you spend on campus of whatever of the organizations that I mentioned. There's Amgen, Pfizer, and some other ones. So this has been, it's a very long process. So we talked with them and we found mentors who work in different areas. So some of them, most of them actually are kind of scientist positions. So they have a scientist who works at, say, Amgen, and then you go and you work with that scientist 10 hours a week to kind of learn what it's like to be in that position. But we also have, so one of the most interesting ones was the CEO of Merrimack Pharmaceuticals said that he wanted 2 part-time interns to just follow him around and do like quote-unquote business development, but really just be exposed to what he does, which we were surprised by. We never even thought to go talk to a CEO of a big company and say, would you like to have a part-time intern follow you around? But that, I think, was an extremely useful process. So there wasn't really any science involved there. It was more just kind of shadowing and meeting people. The second part of the question was concerns in creating the course. I think that was the third part. So the biggest problem was really legal issues. There's a lot of legal issues in having students go work at other organizations, and it just has to be dealt with. You just have to talk to lawyers from MIT. You have to, or from whatever organization, academic institution. You have to talk to the lawyers from the company, and then you have to kind of clearly define who owns intellectual property that is created by the students while they're interning, and what exactly they're doing. So in our case, the easiest way to get it through was to say basically that they're not going to be working on anything like significant or tangible. It's just an experience course, and that's how it got pushed through.
So this is more of a comment, and I'm trying to look back about the origins of Sana. So Sana is not really a startup company, but it's an entity that had the same pains trying to establish credibility, trying to gain funding. When it all started, it was an open source technology. It's never been used anywhere in the world. We didn't have any connections to any super connectors, so we had to do it all by ourselves. And I think one advantage that we had is we have our regular jobs to give us some income, and we worked on this as a hobby. And you found people who shared your passion. And the thing that you're gonna have to do at the start would be knock on 1,000 doors. Like, you keep trying to convince people that what you're trying to do is something that's relevant, that's gonna change the world. Initially, you don't have any proof. Like, we didn't have any proof. They had to take our word for it. And slowly the funding trickled in. There are competitions out there, and one of the first funding that we got was from Vodafone Foundation. And we also won an award from the United Nations Foundation. And it's not a whole lot of money, but when you start getting recognition, now you have some credibility that, oh, these people actually believed us. Maybe you're worth talking to again. But initially, we spent a lot of our time talking to thousands of people, and among those thousands, only 1 or 2 would pan out. And a lot of people get discouraged that, oh, why are you talking to these people? You're spending an hour. But in the process of trying to explain your mission, it's an opportunity for you to actually polish the way you sell your product. And you just have to be persistent. As I said, we didn't have the luxury of knowing Bob Langer or any of the big names at MIT who could easily have channeled some significant amount of money to us. Like, initially, we were getting not a big amount, but again, you push through. Our advantage is that we have some day jobs that we continue to do, and we were doing the Sana activities outside the work hours. And then you continue to attract more brilliant minds, more passionate individuals to join our group. And slowly, it was a painful process. We've been around for a while, but it took us a long time to actually be involved in real projects, get sufficient money to be able to build products and customize the software. I think the open source software too was a big help, because now you're not relying on just having one software developer who will build all your products. When you make your software open source, what you're going after would be building a community of software developers who are also sharing the same mission and goals with you, and who could now contribute to that particular source code. So I think those are some of the factors that allowed us to continue. Like, there were several other groups who were sort of doing similar things at the same time when Sana started, and all of them are, for the most part, gone. And a lot of them actually got more funding than we did. And I'm trying to see if we could actually chronicle this and come up with some formula to explain how we got to where we are now. But just some comments.
Yeah, I think I 100% agree with all of that. I think when we first started, there was a lot of resistance to the idea that graduate students would, pursue careers beyond academia. And I had several meetings almost every day for like a long, long time. And lots of those, I remember one in particular was with the dean of maybe it was the head of biology or something along these lines. And he just basically kicked us out of his room and said, students need to focus on getting postdoc positions and nothing else. You're like ruining the culture of MIT and all this stuff, which was, kind of disheartening for us because we've spent a lot of time doing this. But I think the other thing that Leo touched on that I think is 100% accurate is by going through this process. I mean, we would show people this chart that said, okay, here's the number of faculty positions. It's 10% in 1920, of all graduates, and it's 10% in 2016 of all graduates or whatever. But the number of graduates or the number of faculty positions has stayed stable, basically in absolute terms, for almost 100 years, and then the number of graduate students has 10 times greater than there was 100 years ago. And they still, they don't care. But through the process, you meet a few people that actually will say, yeah, this is 100% a problem. I agree with you. I've been looking for someone to do something like this, but I'm too busy or whatever. And then you have a real ally who's not just stamping you, but who really believes in what you're doing and is really motivated to help you succeed and connects you with other people. Or at least that's been my experience as well. So I think it's 100% accurate.
Hi, I'm Nantida from Faculty of Computer Engineering, and I want to know that in my faculty and many faculty, we don't have the course about management, and I want to know your student which other way that they learn about management or startup, that not this course, yeah.
In the course that I talked about, or in a separate course? Are you talking about in the course that I talked about, or in the separate course? Or
that you talk about.
In what?
The curriculum for computer science, their management.
No, there's not. But there is a lot of courses. I mean, you can take courses in management if you want. I think they're overvalued. I don't. But yeah, I think you can. There's also, I showed you the chart about Wikipedia. If you want to find information about entrepreneurship, there's more information online than you could digest if you spent your entire life reading about entrepreneurship. So I would recommend actually checking some of those out. MIT and Harvard both have open courses. Stanford has open courses that you can go and you can watch the course and you can effectively be there and listen. There's books that are available online about entrepreneurship. I think, there's lots of blog posts as well. So I'd be happy to give you, a 10-page list of reading if you would like it. Yeah.
Thank you.
Sure.
Oh, yes. Now they all want to ask questions.
Good morning. My name is Patalaporn. I'm in Humanity and Social Sciences. I have a question because I have heard from your talk that there are a MIT alumni group, right? And we're also trying to do the same thing here too. But when we start to do something, the older people, all the people in the office, they would say like, no, you were just a kid. You shouldn't do that. You should study. How did you convince the people to agree with you?
Yeah.
Thank you.
So pretty much we just did it and then told them that it was done. I think it's the best strategy is to really just try and do it, and then if they have a problem with it, they'll come and talk to you. But the reality is, I mean, this is my experience, but people who would tell you no are so busy that unless you actually go to them and say, will you say yes or no to this, and they can just say no, they don't really have much incentive to kind of seek you out and shut you down. So I would suggest doing that, but I'd also suggest, just like Leo said, meeting as much as possible with these people and explaining your reasons, you know. And if you have good reasons and you have a few supporters that are influential, they should, I would hope, that you'd be able to get to the point where people would be amenable to that.
Okay, so I saw from your lecture that you mentioned about the problem that the academic industry and the students, they not like communicate to each other too much. And in Thailand, like Dr. Bunchai mentioned yesterday, yes, because in Thai we lack both of that. And could you like recommend some good idea for us to like, how can we talk to each other, like she mentioned before, like some people older that to understand like the real problem, and how can we talk to each other to more understanding?
Yeah, so I think I tried to outline some steps for doing that. I think creating kind of like a central organization where you can get people from both sides can be very useful for that, because I assume that there are many other students like you who are interested in this, and if you collect them all together, then you have a force to be reckoned with that can go and meet all of these people and can share connections and kind of start this process. And then once you have enough critical mass, which I would guess would take maybe a day or two, or something along maybe a month, then you can go talk to industry and say, I mean, this is what we did all the time. So we grow more and more people. We'd go talk to companies and say, hi, we're the MIT Biotech Group. We're interested in facilitating connections with this. What can we do together? You know, and that's how we ended up with the drug development simulation. That's how we ended up with the course. A lot of people just basically said, I don't know, there's nothing really to do. I have a real job to do. But some people were very interested in that. So I think, having a group of people that are interested in, and then just going and talking to people and having some credibility as being an organization is very helpful as well. So, yeah.
Actually ใช้สิทธิพาดพิงครับ Actually I think this is a good request, and you know you are the catalyst of what health science and IT group to come together, and I think this is a good opportunity. Maybe this message can go to like the president of the university that you can build up this kind of the environment, and maybe you know our culture and our environment is very different from the MIT. What I heard that they are more talent guy. They have a very good idea. We are still in the development country, and at least that one thing. Another thing is that for doctor, they're starting 6 years. They don't have time, and the one that know the issue of healthcare is the resident. It's not the student. But you are the student in the computer science. You do your work and you want to do something good. How can we in Thailand create this kind of the environment that like the demand, the user understand and can tell you, and you not just the imagine what is good but know the real thing. I think this can be nurtured in the university, and KKU has a very good opportunity to initiate this. And why don't send this message to the very high level, the president, the dean of the every faculty to create this kind of the environment. That is what my comments.
ใช้สิทธิ์พาดพิงอีกเลยค่ะ I think this is why we are here today because you know to be honest this project is an innovative one and I think KKU provide a great opportunity that we have various fields and various deans who are so supportive and I think this is one of our strengths that we can come together and create more impact to our society. It's not just Thai society, but it can be global because if this innovative program proves that it's really help to bring up the health, in our theme is healthcare improvement, quality healthcare improvement. If we can do this, we can apply to other things too. I think the hackathon will be very interesting and I really look forward to have your participation and interaction and they will be with us, you know, tomorrow. We will be together for tomorrow, Thursday and Friday and more. It's not only this Friday, right? More years to come. Yeah, this is just the beginning. Hope so. If we still together. Oh, every year. Okay, come to check us out. Huh? Oh, Leo. See, we have the witness.
No, one of the suggestions that that we typically do for every event like this is to write a white paper. So what were the lessons learned? What are the next steps? And publish that. And then send that to the president of KKU. And then you come up with concrete steps of what to do to be able to address the issues raised in the white paper.
So, not to touch on this too much, but you mentioned going to the president, so that's exactly actually what we did. Back when we first started, there was 4 of us, and we somehow got a meeting with the president of MIT, and sat down in his beautiful office, and we had slides, and we said, this is a real problem. Here's our evidence of this problem. We're trying to create an organization to solve it. And he met with us for maybe a half hour or something less than that. But as he left, he said he told his chief of staff to connect us with, I think, 4 other people. He said, this is a good idea. I want it to happen here. I'm going to connect you to these 4 people. Those 4 people ended up being the CEO of the biggest venture capital fund nearby, another guy who's a partner, people who were very high up. And we were referred by the president of MIT. So I think we had some credibility in that sense. But it wasn't, it wasn't for no reason. We had gone to him and spoke with him just like exactly what Leo said. So I think that's a very good point. The other point that I would bring up is it's easy to say that, we did this because we were at MIT and MIT has all these, kids and it's really, that are smart and it's conducive to innovation. I think that is, it's true. I like MIT, but I also think that it's not, I don't think it's that different here. I've met lots of deans. I've been fortunate to meet lots of deans. I've met a few students. I'd like to meet more students. But you guys are the same level as most of the people that I meet at MIT. So if we can do this, you guys can absolutely do it to this or a better extent. I 100% believe that. So yeah.
May I have a very quick comment on the Rio comment about the white paper and report. This is a good opportunity for Thailand as the country that you starting record the process of what we do in the next 2 days and the result of this and do it as the process that can do the hackathon in other institute or other organization. Next time we may not need MIT, we just need the KKU. Yeah, I think this is too sustainable. Stand for our feet, not have to waiting for Leo.
What we're trying to do is establish these hubs. So for example, we have partners. What we want would be KKU would be a center of excellence for activities like this. And then the region looks up to KKU and they try to replicate what you have here in Southeast Asia as well. So we've been doing that in South America. We've been working with Colombia, and then the other South American countries are now looking to Colombia and Mexico. So what we wanted would be countries in the same region helping each other, trying to build these innovation hubs.
Furthermore, as we said, we think geniuses are everywhere. We think that you are just as smart as everybody in the Boston area. So, selfishly, we want to collaborate with you in the future so that we can actually learn from you as well. So it's a continued sharing. We learn from each other. It's not just we're teaching you. We're not professors. We're not just giving you. We're not paternalistic where we're trying to tell you how to do things. It's collaboration. It's a research collaboration, project collaboration, and innovation collaboration. So hopefully we do get to come back.
Right, thank you very much, James, and thank you for a very stimulating discussion and collaboration in the future. You have your mic there.
Last thing, the reason we're all here is that everybody wants to bring better health to Northeast Thailand, or the world maybe. But it turns out that if you really look at some of the biggest determinants of health, it's actually having a job and an economic opportunity is as important as medication or a device. And so if Khon Kaen develops economic activity and businesses, you will be helping a lot of people in a number of ways, including health. So having a business that hires people, that gives them jobs and they have incomes, they can send their kids to school, buy medicines, buy food, have a good home, buy a car, it will improve the entire culture and society of Thailand.
Thank you. Now, before we go off to lunch, I have some announcement to make. In the afternoon, this is all the talk and lectures. This concludes all the talks. But for the workshop 1, we're going to change the venues from room 4 to this room because there are nearly 60 people enrolled for James' workshop. So they'll be in this room at 1 o'clock. And for hackathon team, the 20 team and its members, you're invited for the cocktail reception at 3 p.m. next door as well for the group matching. So thank you, everybody, and please enjoy the lunch.
South Asian